excited to be here today. I am Jack.
I'm Jess.
And we are St. John's. We're here together.
So we're introducing
we're
Dr.
doing,
Dina. Got it.
yeah, we're doing good things. But we're here with Dr. Dina Bacon today. Hi, Dr. Dina.
Hi.
How are you this morning?
Excellent. Happy to be here.
We are so excited. So Dr. Dina Bacon has changed our lives, and I think lives of tons of people I know. I want to say everyone I know, but our membership's filling up. We'll get there soon. So with that being said, Dina, tell us, who are you? What do you do? How did you get there?
Oh,
A lot.
how do I get there? Wow. Okay, so my name is Dr. Dina, obviously Bacon. I am from Elizabeth, Louisiana, which is a very small town. It's actually a community. And I was a nurse for over 32 years before I decided to go back to medical school. I lost a child to cancer and medulloblastoma, and it made me realize life is short. So I was an executive director of hospice, and then I realized how terrible patients are treated with insurance. Patients are not the main priority. Insurance and payment is.
Mm-hmm.
And that to me was devastating. And so I had gone through life. I got my LPN, I got my RN, I was working on my master's, and I was like, you know what? I don't like people telling me what to do with my patients. I want to do for them what I want to do for them, regardless of if they can pay or not. Let's just get it done. So when my last child graduated high school, my husband said, go for it, and supported me 100%. And I went to medical school. And in the late old ages of my very late 40s.
So in your late 40s, you decided, hey, I'm done with the system. Like, I know there's a way to do it better and treat people proper. And you decided to put everything on hold, family support, and you went back to become a doctor.
Well, yes,
Okay.
but it was difficult because, you know, when you've been a hardworking person since the age of 15 years old and you've done all these things, it's hard to let go of all of that and say it's okay for somebody else to take care of me. But it also was very difficult because I was a workaholic and my patients were not being treated well. And the ugly truth of it is that I actually had a complete physical breakdown, meaning I broke out in shingles all in my head and my face.
Wow.
As well as a mental breakdown to the point that I was so exhausted and so depressed and so overwhelmed, working 20 plus hours a day because I couldn't stand when my patients couldn't get their bath or they didn't get their wound care done. So all of that became, you can't do this anymore, you're killing yourself.
Yeah.
There's a better way, we gotta find a better way. I mean, of course, I love to say, I'm gonna change the whole world, but I found a way that I can change my small world and be part of a bigger thing that's growing.
Yeah, you made such a difference, even in my family.
Mm-hmm.
So my kids love going to see Dr. Dina.
And so you're a certified doctor. Because a lot of people are like, are you a naturopath? Are you a what? And so I get that question a lot.
I am a board certified family medicine physician. I completed a family medicine residency in Yuma, Arizona, graduated at 51 years old. Woo-hoo! I also won a fellowship while I was there in integrative medicine with Dr. Andrew Will at the University of Arizona, which is a very hard thing to get. I completed 2 years of fellowship while in residency in integrative medicine. So I'm also an integrative medicine certified trained physician. And I've learned, residency and fellowships are all wonderful, but the continuing education is so much more.
Yeah.
Medicine changes every day.
Yeah.
It changes every day. What we knew yesterday will be different tomorrow.
Yeah.
It really does. Even when it comes to the naturopathic stuff, when it comes to whatever. But I am an integrative medicine physician. I was Western medicine for 32 years, but there is a place for both of them in medicine.
Yeah.
It really is.
And so how did you get from, okay, now I'm a board certified family physician, I'm gonna go, because I know you're running this path to go work for someone else and then pivoted. So tell us about that.
So I actually had 3 contracts signed, sealed, and delivered. I almost had all of my credentialing done at the end of residency and was going to be a hospitalist. So I was an ER nurse for over 20 years. I worked with a cardiologist. I worked in cath lab. I've done all these things, and I'm fast. I love to be around people. I love fast medicine, trauma, all that's my thing. Sitting in an office every day was never my intention. So I was actually nominated and I was interviewed by the American Academy of Family Physicians in January of 23. and I won Physician of the Year for the state of Arizona, which was a huge accomplishment. Very overwhelming to say the least. But one of the physicians who interviewed me, Dr. Susan Wilder, shout out to Dr. Susan Wilder, she said a lot of things you said during your interview. Do you know what direct primary care is? And I said, I have no clue. 2.5 hours later, I had a clue. I started reading all of the books. I started listening to the podcast, and I'm like, this is the medicine I dreamed of. This is the old school medicine where you used to know your doctor and their phone number was listed in the phone book. For those who don't know what phone books are, that's the old people stuff. But I mean, it's so personal. It's a patient-doctor relationship. It's no longer calling the nurse or calling the receptionist to leave a message for the nurse to see if the insurance called it. No. It's me and it's you, and that's it.
And I love that. I've never shared this, but my grandpa was a doctor.
Oh, no.
And he was in Ohio, and I remember being little, he had his home office, and he would actually go to homes, like if the baby needed to be delivered or someone was sick. So I think it's great that you do that, because I think we need more of that, really.
Yeah. We're going back to, so direct primary care is going back to old school. We're going back to old school medicine. This is being the patient-doctor relationships that has been lost, that we need to find again. And Direct Primary Care Alliance is what I've joined, and that's the people who are making the difference. And when I first joined this alliance as a resident for free, it was 8,000 physicians throughout the U.S. doing this. Now it's almost 10 to 11,000 that are doing this. I mean, 3 in this area just recently converted from their fee-for-service world to direct primary care.
That gives me goosebumps. It gives me hope, because for so long, I wouldn't take my kids. I wouldn't go to the doctor unless it was like an emergency, because it was just so expensive. We have insurance, and we can't afford to go to the doctor, even though we pay close to $1,000 a month for our insurance. Our deductible is $5,000. And I was like, would we ever get to use the money that we pay in? And it felt like a scam. Not saying that we shouldn't have insurance. You always tell us catastrophic. You still need all of that. But it was just such an eye-opener to see that this existed, and now it's like my mission to tell people that it is an option. And I love that we have, because you can't take on all the patients, and that's not your goal, but your goal is to, share this with the world. It's one of them, and let people know it exists, and now having more people that they can go to too, because you're almost full. So let's talk about that.
Well, I will tell you, there are 15 to 20 physicians in this area that do the same thing I do. So I'm a reacher outer. Tell me how it works. Tell me so I reached out to a lot of direct primary care physicians in this area and met with them when I first moved here and shadowed them every day. And we all decided, let's form a group.
Yeah, I think
so that's what we did. So we actually have a WhatsApp group, and it's called the JAX DPC Physicians. And we WhatsApp each other. I'll say, hey, so-and-so needs a dermatologist. Where's the best one that you think that we can get in quick? I mean, and I've had a lot of members that, I need this, I need that, I need a urologist, I need a pediatric urologist. And we all help each other. There's no competition. We're all in this together, because there's plenty of patients that need help.
And that's how, so 2 out of 4 of my sons this year had their tonsils out. I mean, within months of each other. And they have had strep throat for years and years and years. I mean, I don't even know. Last year, my oldest missed 30-some days of school. My second missed 20-something. We've seen the same doctor. Nothing against the doctor. I mean, we'd gone in for tests. We'd get strep positive, put on medicine, and that was it. There was no conversation. And I guess because I didn't, you don't know what you don't know. And being that it was my first and second child, I don't know, did they need their tonsils out? My husband never got his out, I got mine out. And so, I mean, I just mentioned to you, I was like, man, this has been a lot. And it's just, well, we need to get their tonsils out. We need to do that right now. I'm like, it's so overwhelming. I don't know how to do that. I don't know who to see. It makes me nervous. I know it's just tonsils. It's a routine procedure, but still, they're my babies. And we got Jackson in to one of the best ENTs, if not the best ENT in Jacksonville, almost immediately. In October, he had his surgery, turn around, see you at the beginning of December. And Jackson took a little bit longer with learning the paperwork and insurance and the system. Oh my gosh. But then I came to you in December, and Emmett, my second, his tonsils were like kissing tonsils.
Kissing tonsils, yeah. That means they touch.
And
it's
so,
not good. Choking on food.
All of it. And so I was like, man, this is going to take forever. However, this is the Lord's blessing, because we saw you. We saw Dr. Angela Black the very next week. She's never in 12 years had an open schedule. She had surgery. Apparently her assistant didn't fill up her surgery schedule. She's like, I don't know, I'll try to get you in by the end of the year, because I'm like, hey, I already maxed my deductible. I gotta get the second surgery in. So I go, literally the next week, Emmett had surgery. This turnaround time, just knowing who to go to, knowing I had you to lean on, knowing that you're gonna send me to the right place. And we did, we went through our insurance for that, but just knowing that you know our family and you saw them and you know what they needed was everything to us. Like it's just changed so much. I feel so safe.
Thank you.
You know, and the ER doesn't do it. The ER doesn't make me feel safe. Urgent care doesn't make me feel safe.
Yeah.
I'm like, Dina, like help me.
Yes.
You know?
And I'll tell you this, back to the board certified part of it, I'm following guidelines. When you have so many strep throat infections in a 12-month period, guidelines are it's time to have a conversation and get them out. And the sad part about it is the fee-for-service work, they don't have the time.
No, they don't.
They're rushing through it.
Yeah.
They're not that anybody's a bad doctor. They literally are rushing people through so fast they don't have the time.
And that's what it was, just a
and I
lot
have
of
the time.
Yeah. No, and I love that. And so I just wanted to say thank you for that, because you,
Thank you.
yeah.
Thank you.
Okay, and then let's just stay on track here, because I could talk to you all day, and I will. Okay, so with that being said, now we have the memberships. We're moving into, you've always done aesthetics in your practice, right?
Yes, always.
Always. So now, though, you have some exciting news. You have some things to share with us. You have 2 things that are launching. You're training on them. Tell us about the first one. You know which one I'm talking about.
Yes.
If you don't, just go with it. 'Cause
No,
we'll do
so
it.
I'll tell you this. I don't do anything in my clinic that I've never had done myself because I can't sell anything. People call it, my nurses in the hospice were used to say, oh, you're the silver-tongued fox, you can sell anything. Not true. If I don't believe in it, there's no way I will sell it. No way. So I had Morpheus 8 done while I was in residency in Phoenix, and I loved it so much that I said, call the rep, I said, have the machine waiting on me.
Okay, what is Morpheus 8 and where did you have it done?
So Morpheus 8 is radio frequency microneedling.
Okay.
And it tightens the skin with your own natural, it does the radio frequency, it does the needling, it does the laser, makes your body form its own collagen to tighten your own skin, smooth the skin. And I had excellent results to the point that I was like, I called the rep who doesn't even know me, said, I know I'm going to this area, have a machine waiting on me. I didn't even have an office yet. That's how much I believe in it. So beginning of this year, we upgraded our machine because we wanted to have the better machine, which also does body as well as face and neck. And we upgraded to, we will now have the Lamecca Peak, which is IPL. We will have the Vasculase, which gets rid of the spider veins and the telectages and the different vessels that are through the body that causes you to not feel comfortable about yourself. And then the Forma, which is the thermogenic tightening of the skin, which is personally, so next week we train on it. So excited about that.
Yes.
We're going to get all of the training and all of the certifications. We actually are going to be a master's class, so we'll be a master trainer in February, I believe.
Okay.
And so I'm super excited about giving these services to the patients who really want to, because wellness is not only from the inside, mentally, physically, but how you feel about the outside as well. It really is.
And so that machine can do spider veins, can do the little red cherry dots, can do skin tightening, can do
IPL, which gets rid of
the brown dots.
The aging spots. The Forma's great for the double chins. Morpheus 8's great for the double chins. The dimples on the legs, the skin. So I actually.
Look at me.
No,
Okay,
I was looking at you to say, oh, should we book a double appointment? That was not one-sided. That was like, so you need us.
So with weight loss, you have looser skin. And I personally have done my own arms. I lost over an inch in my arms just from tightening of the skin. I mean, it really is.
And so that's huge for, and I'm just going to kind of backtrack a little bit. So you have a lot of weight loss patients that come to you as well.
I've been doing weight loss for over 4 years.
Yeah. And so it's not even just weight loss, it's the accountability, it's the check-ins. Like you are not, I wouldn't say you're an easy doctor to come to at all.
I refuse to give shots almost every day because it is accountable. I personally have lost 130 pounds. I've been there, I've done that. and it is a change of lifestyle and it's accountability.
Yeah, I agree.
These medications and these things are a tool. They're not a solution.
Yeah.
They're
Yeah.
a tool.
And so with that, you have now a lot of patients that do have loose skin because they've lost a dramatic amount of weight. And so with getting this machine, you're always thinking ahead, like, they need me here, they need me there. What else can I offer them? What else can I do in-house for them to serve them? And how can I make them, like you said, feel good?
Right.
Mentally, physically, all of it. So I
And
love
healthy.
that. And healthy. And
Healthy. We
and
are
it's
all
not just
healthy.
it's not just lose weight. Yeah, it's oh no, you're not gonna eat that anymore. You need to add in exercise. You need to make
no
sure
more sodas.
no sodas. She is anti-soda. She is
No sodas.
Melissa is behind us right now. She is a tough
No sodas.
an amazingly tough doctor in the best way, because we all need tough love. And so truthfully, outside appearances, it wouldn't expect that. Like, you're like, oh, you're so sweet. It's like, you're sweet, you're beautiful, obviously. I mean, you are. And so you're like, oh, you let things slide under the rug. Nope, my husband's a patient. And nothing's sliding under the rug ever. And it makes me so happy because
it's my job.
Yeah. Yes.
It's my job, and I
take
take my job very seriously.
And you do.
And my job is to make you feel better, to make you healthy,
Right.
to make you the best person, because he's got 4 boys he has to help you raise.
Yeah, I can't. I don't want to do that by myself. That was
Nope.
never the goal here.
No.
Okay, and then tell us about the next promotion. So that machine, it's called In Mode, right?
It's the In Mode Optimus Max.
So if
is
you
what we
hear
just
her really
upgraded.
excited talking about In Mode, we're talking about that. She's like, In Mode! And I'm like, what are you saying?
So the In Mode Optimus Max is the newest machine, and I have 6 different things I'm going to be able to offer
I
patients.
love that. And then
Yes.
on top of that, because you're like us, you can't sit still, you're always innovating, you're always looking to next level serve. On top of that, you have talked about launching memberships.
Yes,
Okay.
for aesthetics.
For
So
aesthetics,
aesthetics
yes.
memberships. So, I'm a big believer. I've had a few patients who had a rough life, who had a lot of scarring from whether it be abusive relationships or abuse to them not taking good care of themselves, that can't afford a lot of these treatments.
Yeah.
They really can't. And it's not fair. Everybody should be able to afford to get to feel their best.
Yeah.
So I did drop my prices, and I made sure it was affordable for everyone.
Mhm.
And so membership is going to be kind of the way that we're looking towards,
That's great.
so that everybody has an opportunity to get their Botox if they want it, but also to get rid of those scars that are emotional but also physical.
Yeah, and that's so huge. And there's such I don't know the word I'm looking for. You're always looking to next level. You're always looking to serve. You're always looking to make everything affordable and really truly to help. And so with that being said, so those are your 2 promotions. We have a date set for an event, an evening event, right? And so the reps are going to come in. They're going to do all sorts of not displays. What's the word?
Promotions and
Promotions
demonstrations.
and demonstrations. There we
Yes,
go. And
yes.
so that is March 12th. Did we lock that in?
I'm not sure about the date. I think we did.
I
Okay.
think we did. I
Okay.
think we did. March 12th.
I'm a little bit, I have a lot going on, but
It's
March
gonna
12th
be
sounds
great.
right.
I have it locked in.
Okay.
I just want to make sure I'm talking to the people in the background. And
Perfect.
it's exciting. But no, we're excited to support you. We're excited to be a part of it. We're excited to just continue to watch you grow and watch you serve and do all the things. Are there any
Thank you.
final things that you would like to say before we hop
Well,
on?
first of all, thank you guys. I mean, when I put in my referrals and DPCs come in, and I put in who the referral is from, right now I'm close to 60 BFF members.
That's amazing.
So what you guys do for the female, but also then it extends to their
Yeah.
families, community is unbelievable.
That's amazing.
And I will never turn a soul away, but I am getting to that point that I need to sometimes stop and refresh and make sure that I can give the quality care for every single
Yeah.
person.
Yeah.
But with that being said,
Okay.
I will never turn away a mama who needs help, ever, ever. And I've told you this
Yeah.
before.
That's how I originally came to you.
Yeah.
I literally was like, okay, hi, I don't know. I take care of all my kids. We have insurance. I don't really have any extra funds, but I need help. Like, I don't focus on myself.
Right.
And you were just like, yeah, okay, here's the appointment. You're coming in. I was like, well, I should know you're coming in and you're gotta do this.
So that's where I get kind of tough, is because I was that mama who was single. I was a single mom for a long time, and I had to neglect my own care for a while. And God has blessed me to get to this point in life. A lot of hard work, a lot of support, and God.
Yeah.
So if I have the opportunity to help people, I'm going to help them all day long.
I love it.
And I give away right now, even to some of the BFF members, I give away probably about 15 to 20% of my care for free. I don't make them join the memberships if they can't afford it.
Yeah.
It's about, let's make sure you have your pap smear.
Yeah. Let's make sure.
Let's make sure you've got your mammogram. Oh wait, you've had an abnormal. Oh wait. Let's get this blood work done.
Yeah.
So, and if you can't afford to pay for it, we work it out.
Yeah.
I mean, I barter a lot of my services. I really do.
Yeah.
And if you can't even barter something, still work it out. Everybody has something to offer.
Bring your eggs.
Bring your 2 dozen eggs, people.
I love it. Well, thank you, Dina. We love you so much.
Thank you.
This is a conclusion to our episode with Dr. Dina, but guys, stay tuned. She is just doing all the things. Make sure, where do they want to follow her?
They can follow her. Actually, don't we link to her from our website?
Oh, yeah.
Yeah.
She's a dinosaur. She's right up
The
top.
links on there.
She's right up top. You can click on there. You can make your appointments. You can follow her on social media. It's pure DPC. You can call her. You can
Call her, text her, email
her, all of the things. Again, the only piece de resistance that I would say that she's now accepting nice patients and patients who are obedient to their care. I might get kicked out for the obedience part, but I'm nice. I'm trying. I'm doing the best
Well,
I
I will
can.
say this, is that when you link on my website, you can't just click and join the membership. This is and I'm not saying it's exclusive because it's exclusive. It's just that I need
You
people.
want to know who you're working
I want to know who I'm
Yeah.
working with because it's very personal.
Absolutely.
All of my patients are my friends.
Right.
Mhm.
So it's you have to tell me who referred you.
Yeah.
So it's by referral or invitation only.
Yeah.
I love it. Well, thank you so much.
You're
We
welcome.
love you guys. Stay tuned for our next episode. Lord only knows who's coming on next, but they're going to be fabulous. You guys have a great day. Bye, everyone. Yeah, I promise you, you're going to stay in that bathroom. I'll walk you in the bathroom.